generally eye surgery is equated with cataract surgery. That is the limited knowledge. There is so much more to ophthalmic problems.
If a child is not able to see clearly, unless it's like a major problem, sometimes the parents are totally unaware.
As an eye surgeon, our role is not only to treat the disease, but we need to handhold the patients in their journey.
There is a popular belief that things like squint go off on their own. So what if the child is squinting? By the time he becomes 5-10 years old, it will go off.
So social media trends and fads that come along, we need to deal with that also.
Many times the parents themselves have such a heartbreak that the child needs glasses.
In India, even in place like Nasik, we are able to offer all the treatments that a patient in New York or Los Angeles might want, and using the same machines. It's not the lack of resources that is a problem. It is making people understand that we have availability of the same resources and they can benefit from that. That is a challenge that we face now.
And talking to the patients or counseling the patient is something we don't actually learn during our graduation.
Correct. Nowadays, we hear a lot about violence of patients against doctor. And there is usually nothing wrong with the medical treatment. There is a breakdown of communication that happens for some reason.
The cataract surgery became more of a refractive surgery, where it's not just that you are able to see, it's like you are able to see perfectly without much use of glasses.
Popular perceptions that the doctors' conferences are, meet and greet and drink and dance, affairs. They are not so. I mean, majority of the people who are attending the meeting are very serious about it because they have face problems and they are trying to learn from each other.
Particular patient who has had a problem and you treat it properly, you communicate, and that person comes for the other eye surgery. That is the most gratifying time because it shows the trust that you have built with the patients. You just have to keep positive, and maybe God has something better decided for you when you feel you lose one opportunity. You should always think of Google Maps, where a road is never closed. It can always reroute and you'll get to your destination, or you may get to an even better destination.
One of the greatest happiness that I get is when a patient with bilateral, both eyes having retina problems. So what happens is that up till then, for the patient, you are just a voice. And when you walk into the room after they have started seeing, they don't know the face. And then they see they hear your voice, and then they put face to that voice, and the expression on their face changes to the extent which is, it can't be described in the words.
Welcome to What's a Pro, where we explore the remarkable journeys of professionals who are making significant impact in their field. Today, we are honored to introduce two guests from the world of ophthalmology, hailing from Nashik, India. Dr. Charuta Bapaye is a specialist in pediatric ophthalmology and squints, with a profound interest in pediatric and adult squints, pediatric cataract surgery, and the rehabilitation of visually impaired children. Dr. Charuta has dedicated her career to advancing the field of pediatric eye care. She serves as an honorary consultant at Symbiosis Institute in Nashik and has previously held esteemed positions at Indian Security Press and Wisdom High International School. Her extensive research and contribution to ophthalmologic societies make her a true pioneer in her field. Joining her is Dr. Maneesh Bapaye, who manages the departments of Vitreo-retina, uvea, neuro-ophthalmology, trauma, LASIK, and cataract at Dr. Bapaye Hospital. An authority on all aspects of the medical retina, Dr. Maneesh brings a wealth of expertise in treating complex retinal conditions and performing advanced surgeries. His work in managing retinopathy of prematurity across various NICUs in Nashik underscores his commitment to improving patient outcomes through cutting-edge medical practices. Together, Dr. Charuta and Dr. Maneesh Bapaye have not only elevated the standards of ophthalmic care but have also served as mentors and inspirations to aspiring ophthalmologists. Today, we delve into their journeys, the challenges they have faced, and the innovations they have embraced in their remarkable careers. Please join me in welcoming Dr. Charuta Bapaye and Dr. Maneesh Bapaye to the show. Welcome to WhatsApp Pro. First of all, tell us about your respective specializations and what inspired you to take this as specialization.
Both of us are ophthalmologists, which means we are eye doctors. So we take care of the eye. But in today's world, it's not enough just to be an eye doctor, because the eye itself has so many parts and so many components to it, and there is a specialization of every part. So in that, I am a pediatric ophthalmologist. I take care of children's eyes, because children's eyes are slightly different from the adult eye. They're not just miniature of adult eyes. The problems that the children's eyes have is also a little different from adults. The way you examine them, the way you tackle them, that is different. So this is a completely different specialization within ophthalmology, and that is what I do. And that also involves mainly treating squints. But in squints, I also treat adult squints along with children. So that is my specialization.
And I'm a cataract and retina specialist. So primarily after my completing my residency in ophthalmology, I did fellowship training in vitreo-retinal surgery from Shankar Nethralaya, Chennai, and I also do cataracts. So retina, as you know, is the sensitive layer in the back of the eye, which helps in forming vision and transmitting the images to the brain. And there are a lot of diseases that can affect the retina, like diabetic retinopathy, or because of blood pressure. Retina can become weak because of age-related problems. It can separate from the back of the eye, called as retinal detachment. So there are plethora of diseases that can affect retina. So as a retina specialist, I take care of the retinal problems, and I also treat the cataract. I do also do cataract surgery, as well as refractive surgery, LASIK, and what is called as phakic IOLs.
Nice.
So the second half of your question was what inspired us to join this field. So ophthalmology per se, I don't know. I belong to a family of doctors, but there was nobody who's an ophthalmologist in my family. But I remember writing in my final 10th grade exam, we had an essay on what you want to become in life. And in that also, I had written eye specialist. I don't know what fascinated me towards ophthalmology right from childhood. I had the opportunity of studying ophthalmology from one of the best colleges in the country, that is Christian Medical College, Bellore. And why I took up pediatric, I would like to give the credit to my mother-in-law, who was already practicing in the field. And she knew that it's not enough just to become an ophthalmologist now. Like, you need a specialization, you have to carve a niche in the field. And the pediatrics is a branch which was not very upcoming at that time. There were not too many players in the field. And it's since children are the pillars of tomorrow, it's something that was really required, and which at the same time did not need too much of extra investment, too much of extra instrumentation. It's something you can practice within your routine practice of ophthalmology, and it's very gratifying. So for all these reasons, I took up pediatric ophthalmology and quit.
Nice. How about you, Manish?
I always had influence at home. I'm a second generation eye surgeon, and I have always, from my childhood, being the eldest of the three siblings, I have seen my parents' practice, because I often used to visit them and in the clinic, and I was quite fascinated by the eye care, eyes, and I used to play with my mother's instruments that she would do. So I think it had a subconscious effect on my mind. So when I entered MBBS, uh, that was with the idea that I wanted to become an eye surgeon. And my mother was a trailblazer in this part of the world, because she was one of the earliest people who started doing retina treatments by doing retinal lasers for diabetic retinopathy way back in her 80, in 1980s. And she trained in Shankar Netralaya, where eventually both of us eventually got trained. So it was a fascination that part of part of growing up that I think had an effect on me in becoming eye surgeon and retina surgeon in particular, because I always think I wanted to carry on with my mother's legacy of treating the retinal diseases.
Nice, nice. So, what are the common challenges that you face while treating patients?
Okay, so the thing is, the generally eye surgery is equated with cataract surgery. So if you have an eye problem, you go to an eye surgeon, you get your cataract removed, and next day you see well. That is the limited knowledge that is there as far as eyes are concerned. But there is so much more to the ophthalmic problems. So as a retina specialist, the age group is the same. So people often come very late. They are often not uh, they are not educated, obviously. So it's our job to educate the patients about the treatment. These treatments, the retinal treatments, particularly for diseases like age-related macular degeneration, are very prolonged. So we have to encourage the patients. We have to coax them into continuing the treatment, because if they discontinue treatment halfway, then the disease usually returns. So there is a lot of hand holding. As a eye surgeon, our role is not only to treat the disease, but we need to handhold the patients in their journey from the time they present. There are times when people are frustrated with the treatment itself, because it's a long treatment. The outcomes of retinal diseases may not be up to their expectation. Though I might be very happy with the outcome of a retinal surgery, the patient, it may not be up to patient satisfaction. So talking to them, making them understand as to what we are doing for them, so etc. As far as cataract is concerned, uh, there are so many options are available for cataract surgery and putting intraocular lenses for the patients, the type of surgeries that are available. So we need to again handhold the patient in making them understand what is their need. For example, a patient who's sitting at home and not doing, not doing going out too much. They need their vision need is at arm's length distance. The old lady sitting at home is going to look at things which are at arm's length distance, at the most TV. But a person who's a active working individual, his vision needs are going to be much more different. So in selecting the type of surgery, selecting the type of lens, etc., we need to have, we just don't do the operation, we just don't do the treatment of the disease, but we need to look at the patient as a whole and handhold them from the time they present right up to the completion of their treatment. So these are the challenges. So lack of patients education and oversimplification of uh, eye diseases in popular media, in social media. Another thing is, there are a lot of trends that are coming in social media about the eyes and all. For example, people are it's not very common in India, but I'm sure it is there. People are doing tattoos for their eyes, where they're injecting tattoo ink in conjunctival, subconjunctival space. So that these are risky procedures. We need to make people understand what are the consequences, possible consequences, etc. But yeah, so social media trends and fads that come along, we need to deal with that also with patients. Yeah.
Yeah.
As regards pediatric, the main challenge is first and foremost, many times identifying the problem is the issue, because if a child is not able to see clearly, unless it's like a major problem, sometimes the parents are totally unaware, especially if a child has a problem only in one eye. That goes totally unnoticed because the child is able to do everything with the other eye, and obviously the child does not realize that what he is seeing is not the best. So that is one thing. But nowadays, in India, at least in our part, there is a lot of awareness in schools about the school screening camps do happen in most of the schools. And so these things are picked up early. And many a times it's the teachers who pick up the problems earlier than the parents. Second is then finally bringing the child to us, because there is a popular belief that things like squint go off on their own. So what if the child is squinting? By the time he becomes 5, 10 years old, it will go off. So that is not going to happen. One thing, it's not going to go off in most cases, and even if it reduces, the critical period that in the first 10 years of life, when both eyes should be receiving inputs properly for the vision to develop, in that time, if one eye is squinting, then that eye is going to become lazy. That's what we call amblyopia or lazy eye. So even if you treat the squint later, the critical period of vision development is gone by then. So there are many people who just treat it as a cosmetic problem, and then once the child becomes of marriageable age or going to college, only that time they come and get it treated. So these popular beliefs that things are going to get okay on their own, they hamper the process of the patient coming to us. And then finally, once they do come to us and we start the treatment, then again the problem of compliance comes in. But because making the child all this treatment, especially of this what we call lazy eye, like if a child has a high power only in one eye, or if he has a squint in one eye, then his that particular eye vision, even if you treat the squint, even if you give him glasses, the vision is not optimal. Then you need to give some exercises. You need to close the good eye, and you need to improve the vision in the poor eye or the lazy eye. But see, all this is going to have effect at an age when the child is not able to understand the impact. So the child many times does not cooperate, and then parents these days, it's like sometimes you need to ask them that who is the parent, who's the boss, is he the boss or are you the boss? Because the child many times dominates the parents. So again, the compliance, making the child do the treatment at the right age, that again is a major issue. Or many times the parents themselves have such a heartbreak that the child needs glasses. They themselves are so much averse to the idea that the child needs the glasses that, if you have an attitude like that, then where is your child going to wear glasses from? So all that awareness is the main thing in pediatric ophthalmology. And there are certain things like congenital cataract, like even a small child can have a cataract. A small child can have what we call glaucoma, where the pressure in the eye increases. So even there are cancers that happen in the eye. So these things can be detected only if a routine checkup is done. So this idea of a routine checkup nowadays has come into vogue a little bit. Still, everybody doesn't get a routine checkup, but then yes, things are improving definitely.
See, there is something I would like to tell you is that uh, the problem is you asked us what are the common problems that we face. What problems we do not face is availability of treatments and technologies. So in India, even in place like Nasik, which is which is close to Mumbai, but still it's a tier two city, we are able to offer all the treatments that a person or a patient in New York or Los Angeles might, Chicago might want, and using the same machines. So it's not the lack of technologies or techniques or resources that is a problem. It is making people understand that we have availability of the same resources and they can benefit from that. That is a challenge that we face now. Earlier generation, where they did not have the access to the technologies and the machines, etc., that we do not face anymore. So that is very important for people to understand everywhere, because people think that we are working in a tier two city in India, so there might be lack of resources. So no, that is not there.
Oh, yeah. I was going to ask about the myths that you come across, like squint will go all by itself. That's one of the big myths, right? Or we don't get.
So, talking of the myth, there is something very uh, so something that we should know is that some people have this idea that if you look at the sun in the morning, early morning, it's good for the eyes. So no, it's looking at sun directly is never good for the eyes. You always need to take care. You should not be looking at sun directly. It can cause serious macular burns. Second thing is, uh, I mean, it may not be that common in other parts of the world, but we have certain myths, like if you put onion juice or if you put garlic juice in the eyes, it purifies the eyes. No,
Makes the eye water and then
yeah, it makes the eye water because it is causing irritation of the eyes. So
Orange
those things are those.
peel, they put, right? Orange juice or something.
Yeah, so it's dangerous. These are dangerous myths. They should not be done. So yeah.
in India, over the counter availability of drops is also one big issue, because drops like steroids which have side effect, there are, especially in children, you have allergic conjunctivitis, or like seasonal allergies where the eye becomes red and irritated, and it's something that goes on for several years. But then we'll go and visit the ophthalmologist every time. It's okay, just go to the chemist and take drops. And then what the chemist generally gives is steroids, because steroids are magic drops. They remove the redness and they solve your problem. But then if you keep using it for years together, it causes very serious problems like cataracts and glaucoma. Cataract is still okay, you can at least remove it, but glaucoma is the disease where the eye pressure increases and the optic nerve is damaged. And if that happens at a young age, you can't reverse the damage. Even foreign bodies, we have patients where if a foreign body goes into the eye, they go to some local person who removes the foreign body. Now, obviously, he's not going to have sterile instruments to remove it. So these are things which are still prevalent, like even in this time, but it is prevalent and they are still causing problems. But then, yes, now, so with social media and schools taking part in the awareness, hopefully things will change for the better.
Yeah, that's true. So any difficult client like patients have you come across? Like
Most of my patients are difficult because, as I said, difficult in the sense there are the difficulties can be disease related and difficulties can be patient related. So a disease may not be very difficult to diagnose and treat, but it might be difficult for making the patient understand what I mentioned earlier. So the disease, and when it comes to diseases like retinal problems, the disease itself might be very difficult. So our expertise, surgical expertise, surgical experience, that has to be used. We need to communicate with our peers when we come across difficult cases. We need to keep attending conferences. There is a unfortunately a very popular perceptions that doctors just the doctors conferences are meet and greet and drink and dance affairs. They are not so. I mean, they every meeting, majority of the people who are attending the meeting are very serious about it, because they have face problems, and we are trying to learn from each other in making our patients management and patients' life better. So as far as the difficulty in patient related issues, making patient understand and making patients handhold the patient, we really need to have very good communication skills. And as far as the complicated diseases are concerned, or complicated disease related problems are concerned, we need to keep upgrading our skills. So it's a two ways progress, or two ways journey that we constantly have to keep doing.
And talking to the patients or counseling the patient is something we don't actually learn during our graduation.
Correct. Our medical education, unfortunately, doesn't really make us make us understand the importance of communicating with the patients. We look at the disease, look at the eye or any other body part as a machine that needs to be repaired. But there is a human being who's associated with that, and that also needs to be taken care of. That has come to us with experience, but I'm sure as we go forward, the things will change for better for newer children.
Particularly the diseases that Maneesh treats are more complicated and with less gratifying outcomes. He also treats eye infections, like now surgery, any surgery, no matter how much sterile precautions you take, there is a chance of infection. But the thing is, even if that happens, the important part is communicating it with the patient, going out of your way and treating it properly, getting specialist help. So all that is something which needs to be done, and that I keep seeing in his practice, particularly that is what pays. Talking to the patient.
Yeah. So what she's referring to is management of complications. So I being a retina surgeon, I treat complications of cataract surgery which are happen at the hands of my colleagues, and it's not negligence. It's a complication. That's a outcome of that's an unfortunate outcome very rarely for cataract surgery, even in today's era. So we need to treat that, and it has to have very sympathetic approach, and we have to be very careful about we have to be very careful in treating these patients, because it's the outcome can change massively if we are not very careful. So talking to patient, making people understand in difficult diseases is also very important.
And when that particular patient who has had a problem and you treat it properly, you communicate, and that person comes for the other eye surgery, that is the most gratifying time, because it shows the trust that you have built with the patient.
So these days, this holistic approach is getting very popular, right? Like we did one episode with a dentist. He also showed the same concern, like talking to the patient and make him understand is the most difficult part than other technical part. So
Correct.
there is this thing of holistic approach to talk to patient is coming up. What is your take on it?
Yeah. I think, I mean, that approach is there.
It's already
You
there.
can't treat a patient without talking to them. So in busy practices, there might be people who are assigned for that work, who will talk to the people while the doctor is looking after the disease part. In other practices, the doctors do that by themselves. But in our experience, what we have realized is that a doctor talking to a patient about their disease condition and following answering their FAQs makes a lot of difference in patients' satisfaction, and understanding of the problem. Because sometimes even assigned person, however educated they are, if they are not a medical specialist, they may not be able to answer all the questions. And secondly, the patient may not be that satisfied, even if all the questions are answered. For me or for Charuta, the same questions: when can we clean? When can we take the head bath? How can we clean the eyes? Can we eat this? Can we eat that? So they are something that every single patient asks. But the point to understand is that that patient, for that patient, it's the first time. So we have to look at the patient as a person. He is not a he it's not an entity which is carrying a disease and coming to us. It's a human being who's suffering, and we need to not just treat the disease, but also handhold the patient as a whole, as a person. And there is a family which is there at the back of it, which we need to also talk to in carrying out things. So, nowadays we hear a lot about patient doctor patient violence of patients against doctors. So I think there is, rather than the medical treatment, there is usually nothing wrong with the medical treatment. There is a breakdown of communication that happens for some reason. So I wouldn't really say that doctors are responsible for it every single time, but definitely there is some kind of communication uh, gap of communication that happens, which leads to these kind of incidents. So I think that they have to be looked at holistically, not just at when an incident happens. This needs to come in medical education. In a medical education, how to talk to a patient, how the bedside manners, as they used to be called in earlier, when we were doing MBBS, or our earlier generation was doing MBBS. Nowadays, it's even more important and getting even less uh, even less attention while it is being taught to the students, medical
It should
students.
be incorporated in the basic education itself. That would make a lot of difference.
So as I said, we need to not we need to treat the person as a patient has to be treated as a person. That is very
Right, right. So, what are some of the latest advancements in your fields?
So, two very important advances that are there in pediatric ophthalmology. One thing is nowadays we hear about this myopia epidemic. Like myopia is basically nearsightedness. The child does not see clear for distance, or minus number as we call it. So that is something which has increased tremendously in the recent years, and especially during COVID, because of involved children spend all their time for near work and very less time outdoors. So that is why this number is increasing. So there have been technologies or innovations that have come in by which we can control. Now, minus number is something which comes because the eyeball is a little longer than it should be. And the length of the eyeball is going to go on increasing till the child becomes 18 years old. So no matter, this again is a myth that if you start using glasses and you use them regularly, the number will not increase. But it doesn't happen that way with myopia. No, you should use glasses so that you can see clearly, so that your eye doesn't become lazy. But then even if you use the glasses, the power is going to increase. So there are innovations which have come in to stop, and I won't say stop, but to reduce the speed or slow down the progression of this myopia. One is a drop, which is dilute atropine drops. Now, there have been studies for the last 15 years going on, proper randomized control trials done all over the world, which have shown that this low dose atropine helps in reducing the progression of the minus number. And how that helps is, one thing, you won't get thicker glasses, your number will be under control. And secondly, people who have myopia also have problems in their retina, because their eyeball elongates, the retina gets stretched out, and so they develop retinal problems like retinal breaks, retinal detachment. So if you keep the number under control, it's not just the cosmesis you're looking at, that okay, you won't need thicker glasses, but you're also looking at a long-term thing where the complications related to myopia, like glaucoma or retinal problems, they also reduce. So that is one therapy that has come in, and it is used regularly. You just have to put the drop once at night. It doesn't sting or anything. but you need to give it in a proper age group, like generally this 9 to 13 age group, when the height spurt and all is occurring. At that time, that drop needs to be used. So that is why it is important to consult a pediatric ophthalmologist when you every time you're changing your children's glasses. Because if you just go to the shop and change the glass and take the new number, then you're not going to be aware of such treatments. And there are also myopia control glasses also that have come up. There are myopia control contact lenses also that have come in, and they are also showing good efficacy. So they have a separate technology by which the progression of myopia is slowed down. And another innovation in our field is the treatment of lazy eye. So this lazy eye, the only treatment till now used to be closing the good eye. You have to patch the good eye for certain hours in the day. Initially, it used to be done full time. Then there were studies to show that even part time helps, because full time sometimes becomes a little problematic. But then part time also helps. And now there are new, we call it dichoptic therapy. So these are, they're like video games. They're basically cloud based, computer based therapies where the child wears glasses, red, blue glasses, and he actually sort of plays games like video games. So for about half an hour in the day. And the therapy goes on for a month or 2 months. And that is also showing good. So those children who are non-compliant to patching, they can definitely use this dichoptic therapy. And this is available in India also by under the name Binox. Then worldwide also they have different companies coming up with this. But then this is also another option where we can maximize the improvement in the child's vision at an age where it's really going to help, because after 18 it will not help. So these are the two main things in pediatric ophthalmology. And as regards,
Uh,
This
in
corrective,
the
sorry to cut you off. There are these
yes,
corrective lenses that are getting popular, right? Like you wear them at night and the whole day you don't have to wear.
yeah, that is again another therapy for myopia, control of myopia progression. But then those ortho K lenses that you are talking about, where you wear them at night and then during the day you see clear, those in very small children wearing those lenses at night is a little problematic, because the child has to be able to handle them. These two therapies that or sometimes like you're directly wearing it on the eye, so the chance of infection is there. But these two therapies that I'm talking about, where you just put these drops which have no side effects, and you anyway you're going to use glasses, so you just use these type of glasses. So these are more hassle-free treatments, basically, rather than this treatment that you're talking about.
Yeah.
I would divide the things in cataract and retina, and also some. To put it very broadly, we are getting better drugs to treat diseases like age-related macular degeneration, which are in the form of injections, and it's an ongoing process. So I'm sure we are going to get more and more of them. What we are trying to do is give the lesser number of injections and increase the period between the two injections. These are called as antivascular endothelial growth factor injections, which are already there. We are using them for 20 years, but we are getting better and better molecules as we go forward. As far as the surgery of retinal diseases is concerned, we are getting better machines which work faster. When I was doing fellowship 20 years back, the surgery which would easily take 2 hours, we usually finish in 20 to 30 minutes now. We are treating much more difficult cases at much more faster rate, and with much better visual outcomes. So those things are, again, it's an ongoing process that is happening. As far as the diagnosis of the retinal diseases is concerned, you would have seen CEO of Google, the video, very famous uh, video of Google CEO, where he was talking about the AI. So that is very exciting field. So diagnosis and telediagnosis. So you don't even need to see the patient. You just need to see the patient's photograph of patient's retina, and AI algorithm will diagnose the diseases of the retina. And not just diseases of the retina, these algorithms seem to, if you show a picture of retina to a human being, even a trained retina surgeon, he would not be able to tell you whether it's a male or female's eye. The AI can do that. The AI seems to be able to detect risk of systemic diseases like heart disease, just looking at the photograph, because how it exactly works, nobody really knows. Even the AI specialists do not know how it is telling all this information, which is beyond human scope of human mind. But it is something which will be, so looking at retina will be not just understanding the retina disease or diagnosing it, but it is going to be a window to general health of the patient also. So AI is a big thing in diagnostics, even in treatment, planning the treatment, giving the treatment the surgeon would do, but planning the treatment, the algorithms and the AI would be helpful. We'll be looking at, there are already, when it comes to cataract operation, there are already very good lenses which are giving us vision, very crystal clear vision at uh, different focusing areas, like far off, intermediate, like at your computer, or reading like mobile, or reading distance. But I think even better lens, there are certain drawbacks which should be taken care of as the time passes. There are there is a very interesting case that has recently happened in US. There is a US veteran who had lost both his eyes, and his total eye transplant was done a year back. So they have not just put the corneal transplant, or not just changed the lens. What we thought up till now, that the optic nerve and retina cannot be replaced. So they have done, optic nerve has been reconnected, and that patient seems to be getting some good vision. I mean, seems to be getting some vision. He was blind by both eyes. He's getting some vision. So as the things move forward, that is something which we have not imagined. But to tell you the truth, the lot of things that we are doing in our today's practice, we had not imagined when I was training only 20 years back. Forget when when my mother was practicing retina. Even when I was training, there are a lot of things that we never really thought that we would be doing them. But in another 20 years, there are very exciting times as far as the disease of difficult eye problems like retinal detachment, age-related macular degeneration, disease of the optic nerve, or the glaucoma, that is very damaging eye disease. So I'm sure we are going to look at many new technologies that are coming in.
I would like to mention, or Manish can mention his own innovations also in
Yeah.
this.
So as far as innovations, our contribution to Bapaye Hospital's contribution to field of eye care or field of retinal surgery has been that we have devised a instrument called as the claw forceps, which is used to remove large foreign bodies from the eyes of the patients. So there are certain times when the foreign bodies are large, they have very uneven surfaces, and they are non-magnetic. The magnetic foreign bodies, metal foreign bodies, which are small metal foreign bodies, are not very uncommon in our practice. And there are some magnets which are available, which we use as a part of retinal surgery instrument, which can remove it. But large irregular objects like a glass piece or the air gun, those air gun pellets, those things, they are which are made of lead, they can't be removed with magnets, and they are irregular in shape. So such things are can be removed with this particular forceps. And the it was very gratifying to see that in unfortunate incident of what happened in 2016 in Kashmir, where there were a lot of young people who got injured because of these pellets, air gun pellets in the eyes. So the claw forceps was used very extensively by surgeons who were operating in that, in removing those pellets before this forceps was sent by my friend who helped me manufacture the forceps, that those it was very difficult for them to remove these pellets. But once that forceps came along, it helped them a lot, and I'm very proud to say that even it is used in Harvard Medical School by the retina department there in certain cases. My second innovation has been what we call aspiration scraper, that is used in a very critical step in retina surgery in challenging scenarios. What we call posterior vitreous detachment, detaching the vitreous from the retina, which is integral part of retina surgery in a large number of cases. So there we have developed an instrument called as aspiration scraper. Both these innovations have been, they are widely accepted, and they have got awards at All India Ophthalmology meetings as a new developments. So these are our contributions, real innovations that we have been able to do as a part of retinal surgery. Yeah,
Wow, that's amazing. Congratulations.
thank you,
When you
thank you.
say foreign particles, is it very common to get into eye? Like,
Yeah, so again, there is a difference. It's again about the patients or the common people's understanding. If you see the industrial safety standards in Western countries, they are very. You would see any video of a worker, working on a shop floor. They are always wearing protective glasses. Yeah, but those in India also by law it is necessary for those glasses be provided, but and they are provided by a lot of people or almost everybody who own a industrial plant, but somehow the workers who are from lower socioeconomic strata, lesser educated background, they feel that if something is being made compulsory, yeah, they find it a burden, so they end up not using it and then get hit in the eye. So it's usually these are small iron particles which go in the eye. So but sometimes they are very large.
Even the use of
Objects.
helmets, though it is compulsory, it's not really so. Even in road traffic accidents, these foreign bodies do go into the eye.
over the period of 20 years that of your career span, how has the the course of treatment changed?
Yeah, so the course of treatment has changed almost dramatically. So when was doing my post graduation and then my fellowship training, the methods that we were using have totally changed. So when I started doing cataract surgery in 2008, we had very basic phacoemulsification machines. The phacoemulsification, what is the standard surgery that is available? Uh, those machines have upgraded. Those machines have become more sophisticated. They cause less injury or less trauma inside the eye as the surgery progresses. They have become safer. The chances of problems coming, even in very difficult cases, have gone down over a period of time. Nowadays, there is a technology called as femtolaser assisted cataract surgery. Though the technology has been there for a few years few years in the sense last 8-10 years in Western countries and even in India in metro cities, we have acquired a femtolaser assisted cataract surgery, or what is commonly called as robotic cataract surgery in Nasik for last 1 to 1.5 years, and we are offering robotic cataract surgery. So what it does is basically uses laser technology, femtolaser technology, for doing some specific and very crucial steps of the cataract surgery, which makes cataract surgery more safer, predictable, and even more safe than the advanced phacoemulsification. So that is the technology that we have. As far as the retina surgery is concerned, the retina surgery has changed almost 180 degree. The way we see the retina, the way we operate, the machines that we use, the speed of surgery that we can offer to the patients has changed dramatically. So I think we are giving much more, what can you say, safer surgery, faster and more customized surgery to our patient. So over a period of last 20 years.
Femto laser basically eliminates the manual error part in crucial steps of cataract surgery and makes it more precise. And so we are happy to be one of the earliest people to offer it, apart from the metro cities of Mumbai and Pune.
Wow, that's amazing. Any success stories you want to share?
We have a success story in the house itself. So, as we said, we are second generation ophthalmologists. So, my mother-in-law has been one of the pioneer ophthalmologists in Nasik. And her story is like when she entered the field of ophthalmology, it was only cataract. It was basically a refractive error, that is spectacle power and cataract. That was all that ophthalmology was limited to. So you have a trial set and you check the power, you give glasses, and then you remove the cataract. Even intraocular lenses were not there at that time. And then started this revolution in ophthalmology started after that. So then intraocular lenses came in, then retinal lasers. Then at that time, it used to be a large incision cataract surgery where you had to make a big wound and remove the entire cataract. Then this small incision surgery came in, and then phacoemulsification came in, where you emulsify the cataract into a sort of churn it up, and then you suck it out. So everything is done through a very small incision that makes the surgery more precise, and you don't really need glass. The cataract surgery became more of a refractive surgery where it's not just that you are able to see, it's like you are able to see perfectly without much use of glasses. So all that all those developments came in, and then she is one person who kept updating herself. So that is definitely an inspiration for us, that like we continued it was never like okay, so we've invested enough, now stick to what we are doing. It was never like that. We entered a scenario where we were free to upgrade whatever we wanted. There was never any thought about investing further, because she had always been doing that, and we just sort of continued the same trend. And that is why we are able to give state of the art services by keeping on upgrading ourselves. So I think, and that is one thing about our hospital, that the USP of our hospital is the faith or the trust that the people have. It's sort of like, okay, if you want genuine advice, let's go to Dr. Bapaye once and ask her. So that is again, thankfully we've been able to continue that, but that faith is something which she established. And that is something different, because that mouth to mouth publicity and that faith sort of brings us more patients than the typical marketing techniques that are in vogue these days. So
Yeah,
that is the success story that is there in the house itself.
that was my next question actually. What is your marketing strategy? Like, how do you market your, like, this new innovations are done or
So,
any?
so uh, what she said again, we are kind of old school people. I think our patients are our best marketing agents. So we create awareness. We have a website, we have a Instagram account, but the idea is to convey what we are providing. We don't do so many current trends which are there. We try to avoid any of those, following any of those, and let our work speak. And by grace of God, for last 41 years, for initially my mother and now all of us put together. I think that our patients are our best marketing agents.
That's one very good thing about squint surgery. That is something like most of my surgical squint patients are related to some squint patient I have already operated, because squint is something which people directly see. Or like retina and all, though it is a challenging branch, unfortunately, the patient or the relatives don't really see the difference or see what you've done. But squint is something which, you just look at a person and you can see the difference. And the confidence that changes after you straighten the eyes is phenomenal. So for squint, the best thing is do a good squint surgery that fetches you more patients.
What is your take on the dermal fillers? Does that affect the eye? That it's a cosmetic procedure that they do, right? The fill.
Yeah, so basically, Botox and fillers is something that is like quite widely done these days. Not that much in Nasik for aesthetic purposes, but in Mumbai, yes, there are people who like go during their lunchtime and get fillers done and go back to work. So that I do Botox, but I do it more for functional problems. There are certain problems called blepharospasm where the eye, keeps winking, or sometimes it just closes involuntarily. You can't open it up due to that muscle spasm. So there also we give Botox. The fillers are only cosmetic, but again, that I would say it has its side effects. So it should be done only where really indicated and by a proper oculoplasty specialist, because there have been cases where they have been wrongly injected into the eye, the Botox and fillers both, and that definitely does cause problems. So the area around the eye is very small, the skin is very thin. So only you should get it done only by a proper oculoplasty expert.
So basically surgeon who's well trained in that. Unfortunately, the Botox and all is also given nowadays by in India at least by there are some spas and all
Yeah.
where unqualified people are giving. So it's not uh, it's not a facial. People need to understand that it's not a facial, which is an external thing which has which are no side effects. So
As somebody who knows the proper anatomy and layers of the area around the eye, only that person
properly
should
trained
be
person should be doing.
handling these things. So if done properly, that's fine.
Any advice for the students who want to take this as specialization, like pediatric care first and then retina and cataract?
Yeah, so ophthalmology is a very good branch. As we already said, it's like advancing by leaps and bounds. And so it's definitely a good field to come in. Every field has its competition, every field has its problems. But then, yes, you have to overcome those problems and practice. Uh, I would just like to cite one story of my own experience, which I think is very important for students these days. I was always like a very studious person, and I had this dream that I want to do MBBS in Mumbai. That was my dream. I slogged for it in 12th, and I got good marks, but somewhere in physics, I wrote one digit wrong, and so one sum went wrong, and I my marks didn't qualify to go to Mumbai. So I took admission in a college in Solapur, Dr. VM Medical College in Solapur. So okay, then I decided, okay, now there was this option where if you come first in your first year, if you come first in the university, then you can get a transfer to wherever you want. So again, I studied hard in first year. My aim was to go to Mumbai. Now I managed to come first. I went and applied, and I got admitted to Seth GS Medical College, Mumbai, which is one of the best medical colleges in Mumbai. So I was very happy. It was a Saturday. I was told, okay, your admission is granted. You come on Monday and pay the fees. It was that secure. And then suddenly on Monday, my father gets a call that the rules have changed, and now you need a domicile of Mumbai. You have to be staying here for 10 years if you want admission here. So unfortunately, which you don't do since I was from Kolhapur, so you won't be, your admission is cancelled. Now, there is no possibility that a rule can be changed over a Saturday and Sunday. There was obviously something behind it, which I don't want to go into the details, but some external political force acting where somebody else wanted the seat. And so I did not get it, though I was eligible for it. Now, at such crossroads, you feel that, oh, I have been working for the last so many years to get this particularly. Bombay was the high point, like that is where I wanted to study. And then you feel that, uh, what's the use? There's no use of slogging so hard if this is going to happen. But then, as luck would have it, okay, so I continued in Solapur, but because I continued in one particular place, I got the best outgoing student prize of my batch. So I was the best outgoing student. And then later on, when I applied for ophthalmology, I wanted to do it in Christian Medical College, which is one of the best colleges. When I was going there, everybody was telling me, why are you going for that entrance? Because you're a Hindu. They're not going to give you admission. But then, no, we still went because they had open merit. It's not that they gave only to Christians. And there, as luck would have it, they had a provision where if you are the best outgoing student of a particular college, you get 5 marks grace. And in their entrance, each MCQ was 1/4 mark. So since I had that certificate, I was 20 questions, sort of 20 questions ahead of others. And that helped me to get into CMC. So the when like I lost the opportunity to go to Mumbai, I continued in Solapur. But because I did that, I got this best outgoing certificate, which helped me to get into a even better college. Like the ophthalmology education in CMC is far above that even in Mumbai. So sometimes the thing I would like to tell the students is sometimes you feel that, oh God, doors are closed and there's no use of working so hard, but you never know that the some other door is going to open for you, and opportunities are always going to be there. So it's, you just have to keep positive, and maybe God has something better decided for you when you feel you lose one opportunity. And in today's days where all this tension and competition has become extremely severe, in our days it was not this severe. I think this is very important. Like you should always think of Google Maps where reroute, that there is no the road is never closed. It can always reroute and you'll get to your destination, or you may get to an even better destination.
You get
That's one thing I definitely want to convey.
whatever happens, happens for the best.
Happens for the best. Yes.
How about Manish? Do you have any advice?
So I think ophthalmology is a great branch. Ophthalmology is a very niche branch. So there are a lot of new exciting things are coming. However, ophthalmology is very expensive to practice as a private practice. So when you go into ophthalmology, for example, a person who's doing MD medicine, they are, though there are gadgets which have come, though there is a technological advances are there, a person who's can practice medicine if they want to a limited extent. But you, if somebody wants to do ophthalmology and wants to practice in a minimal, bare minimum of ophthalmology, still you need investment which is in multiples of that, as compared to a person who's practicing bare minimum medicine. So not that I'm trying to put down any other specialization of medical care. Everybody works hard. Everybody has their own challenges, and everybody is trying to give their best in very challenging scenarios. As far as ophthalmology is concerned, a person who's taking up ophthalmology has to be aware of this. However, we are seeing a lot of corporatization of ophthalmology in India. So the job opportunities will open up more. Uh, People from my generation are coming together and forming group practices. So that is a trend which will come. So again, coming back to all these things, a person who's interested in ophthalmology should work on their communication skills, but the communication skill is going to be an integral part of ophthalmic practice as we go ahead. You don't have to just communicate with you know not just with uh, your patient, but also with your staff, also with your colleagues with whom you might be working, planning to practice for significant number of years. So, but it's an exciting field, and the joy that you see on a patient's face after they start seeing well. One of the greatest happiness that I get is when a patient with bilateral both eyes having retina problems, like in diabetic patients, they have bleeding in both eyes, and then they come back after the treatment, and then they start seeing. So what happens is that up till then, for the patient, the relatives know you, but for the patient, you are just a voice. And when you walk into the room after they have started seeing, uh, they don't know the face, and then they hear your voice, and then they put face to that voice, and the expression on their face changes to the extent which is, it can't be described in the words. So you want to have that happiness. I think you should take up ophthalmology. Yes.
Wow, that is very satisfying, like experience, right? Like,
Yes.
so how do you wind down after your like hectic day? I mean, you keep meeting people who are mostly unhappy the whole day. How do you keep your sanity?
Ophthalmology that way is not a very, like, compared to something like cancer specialist and people, cardiologist. Compared to that, we definitely are in a branch where the patient is that way hale and hearty. It's not like it's a very depressing branch. So that way it's good. And yes, we do have to have, like, I do limit my working hours and come back to my children, because in today's world you also need to pay a lot of attention to how your kids are growing up. So I think kind of distribution of your work responsibilities and family responsibilities, and then on Sundays, definitely that me time is there. Like, me being a pediatric ophthalmologist, I was considering initially that maybe I should be working on Sundays because kids are free. But then I decided against it, because that Sunday has to be for the family. We work on Saturdays because Saturday is also the industrial off and school off for in Nasik. So we get a lot of patients on Saturdays, but then Sundays we do keep off.
Yeah. Finally, any advices for eye care?
First and foremost, having a routine eye checkup is with a proper ophthalmologist is very important. In India, there is a trend of these vision. Actually, I think in US also, the optometrists only see the patient initially, but then they are referred to the ophthalmologist. But in India, many times they are seen by the optometrist and in the vision center, and it stays there. They don't reach the ophthalmologist sometimes on time. So having a routine eye checkup with a proper trained ophthalmologist is very important. There are certain diseases like glaucoma where you have absolutely no symptoms, and that is a kind of silent killer. It can totally destroy your vision, and that vision cannot be regained, and you will have no symptoms. You will realize it only after you lose your vision. But that can be totally avoided if you have a yearly eye checkup. Your intraocular pressure is checked. So even if anyone wants to change their glasses, it is better done after a checkup, not directly in the optical shop. Secondly, do not use any over-the-counter eye drops or any local therapies without consulting an ophthalmologist. Children need to have checkups. The limitation of screen time is again a big issue these days. I used to tell parents that okay, half an hour of screen time, but then I realized myself that half an hour is nothing. It's not going to be enough. But then
You
okay,
said
use
half,
screen only yeah,
so when you
where
say
required.
goes on to 2 hours, so better
Yeah.
start with half
So
an hour.
correct. So, and proper, like while reading, proper lighting conditions, keeping the screen at proper distance. You can use Blu-ray cutting glasses and lubricating eye drops, taking adequate breaks while using the computer. A proper healthy routine, a healthy diet is also important. Now, this again is a myth that you have to keep eating carrots for your eyes to be good. So it's not the particular carrot that is going to help you, but overall, good intake of vitamins and 1 hour for children, particularly 1 hour per day of outdoor sport, because sunlight exposure is very important in both things. One thing, it helps to lower the progression of spectacle power of myopia. And secondly, there are these diseases of the cornea which come in the adolescent age group. There, it's called keratoconus, and we have always learned that vitamin D is required for the strength of our bones. But people don't know it that much that vitamin D is also required for the strength of the cornea. And if you don't go into sunlight, if you don't have outdoor sports, then the cornea develops a weakness called keratoconus, and it can be quite detrimental to vision. So that is very important. That again has preventive treatment if checkup is done on time. So a healthy lifestyle is most important.
So when you say regular checkup, how frequent is that regular checkup? Like once a
In
year?
adults, once a year is enough. And in children who already, like even in children who don't have glasses or don't have any complaints, once a year is sufficient. But somebody who has an eye problem, who has glasses, or somebody who is a diabetic, then 6 monthly is better. uh, just a routine eye checkup every 6 months. All diabetics should have an eye checkup every 6 months, and that eye checkup should not just be routine glasses. You need to dilate the pupils and put drops, dilate the pupils, and check the retina properly. So it has to be a comprehensive eye checkup, but once every 6 months is sufficient.
Thanks, good. Thank you so much, both of you, for your time and your valuable inputs. I'm sure everybody is going to uh, get a lot of knowledge about uh, eye care, and even as students, they got to know lots of inputs. Thank you so much.
It was a pleasure.
Thank you for
Thank you.
inviting us.
It's my pleasure. Thank you.